Students, in this module, we will see that how the medical social work was initiated in Pakistan. After the partition and getting the independence in 1947, the Pakistan country didn't have the professional education in the field of social work. So the Pakistan government requested UNO to send some professional social workers in Pakistan. First of all, a Swedish medical social worker, Miss Anna Motol, visited Karachi in 1953. And in 1953, first medical social worker was employed at Tuberculosis Control and Training Center at Karachi. Afterwards, zakat was withheld from the individual's bank accounts, and the money which was collected through zakat was earmarked for the patient under treatment in hospital in 1980s. And zakat money was spent for the welfare of the patients. And the free medicine and other medical arrangements were made for the patients in the hospitals by the zakat money. Later on, Baitul Mal system was announced from transfer of receipt from grants and taxes from local, provincial and federal governments and authorities, and then voluntary agencies also participated, including like khairat and sadaqat and donations, and other charity from international organizations were also used in the welfare of the patients at medical social services projects in different hospitals. If we see that the 100 medical social work units in Punjab are working, 30 in Sindh and 4 in Balochistan and 4 in Khyber Pakhtunkhwa province. Medical social welfare officer is appointed in medical social services projects, which are known now the medical social services units in hospitals, and assisted by their staff, which include a clerk and the office attendants, and they can hire the other staff as well for their facilitation. A medical social welfare officer usually gets funding from sources like Zakat Department, Baitul Mal, the NGOs like the Patient Welfare Society, and the donation from the public side. And they are usually indulged in the provision of free medicines to the patients, in the arrangement of blood, and to provide the artificial organs to the patients, and to assist financially in the major surgeries of the patients. If we have a glance on the medical social services projects in Lahore city, we see that almost all the major hospitals have the medical social services units in their settings, like the Nawaz Sharif Hospital, Kot Khaja Syeda Hospital, Mayo Hospital, King Edward Medical University, Lady Wellington Hospital, Mia Munshi Hospital, Punjab Institute of Public Health, Fatma Memorial Hospital, Services Hospital, Punjab Institute of Cardiology, Institute of Mental Health, Children Hospital, Anmol Hospital, General Hospital, and Shaukat Khanum Hospital, Gulab Devi Hospital, Jinnah Hospital, and Sir Gangaram Hospital. And almost all the districts of province Punjab also running the medical social services units in their district hospitals and at Tehsil level hospitals, in which a medical professional, a medical social officer provide the medical assistance and medical support to the patients, and work as a member, as a team member, and provide the liaison and linkages between the doctors, the patients, the family members of the patient, and the other paramedical staff of the hospital.